As housing continues to be a top issue in this city, Toronto councillors have voted to declare homelessness in Toronto an emergency. This means Toronto joins Hamilton, Fort Erie and several other municipalities that have taken similar steps. Now, declaring an emergency, though, doesn't prompt any new funding from higher levels of government, but the city says it needs that support to keep up current service levels in the shelter system. City Council also lowering the threshold in this for activating warming centres during wintry weather, with plans to consider 24/7 spaces. So for more on this move and the emergency declaration, we're joined this afternoon by Dr. Nahid Tassani, a palliative care physician, health justice advocate, and assistant professor at the University of Toronto. Dr. Tassani, good to have your time this afternoon. Just the idea that Toronto has declared this and called it an emergency, what's the significance?
Yeah, while it's taken a long time to get to this place, I'm really glad we're at this place. This is an important step. It's a step in the right direction. It's important for Torontonians to remember that we are dealing with an awful homelessness crisis. There's over 10,000 people on the street on any given night. And this gesture, this step really highlights the important needs and really forces governments to get into a place where they need to work together. It's important to say that this step doesn't necessarily come with resources. It's a first step towards resources. I think we've also seen some really unfortunate policies that have lacked compassion over these last few years, violent encampment clearings by the city and police. And we also saw this past winter when the city wouldn't open warming centers at an appropriate threshold, and many people were suffering as a result of that. My hope and the hope of many advocates across the city is this is the start of some important change.
Dr. Tassani, in the wake of this declaration, the Deputy Mayor Jennifer from Calvi said, we are doing everything we can as a city government to help people experiencing homelessness. Do you agree with that statement?
I think that there are steps that have been made, but we can always be doing much more. And I think the point of this declaration is that we need to be doing more. We only have to reflect on what happened during the COVID-19 crisis when money really flowed. We saw federal governments working with provincial governments, with cities, with advocates, with faith groups, with people with lived experiences to develop models of care. And we developed hotel and motel programs, recovery programs, and these programs really made a difference. And we seemingly did that overnight. Why can't we flow money now? Why can't we make that difference now? And I think that's what this declaration is really about. It's about really saying and joining other municipalities that we need more resources, and what's happening at the local level is not enough. It doesn't let the local level off the hook. I mean, everyone needs to work together, and that's really the point of all this.
I realize, Dr. Tassani, that yesterday is probably the answer to this question of when do we need to see, more action from the federal and provincial governments on this here. But what sort of reasonable timeline are you expecting that we start to see some more money flowing to sort of work on this declared emergency?
Yeah, I think you hit it on the nail. I mean, ultimately, the solution to homelessness is high quality, safe, and affordable housing. We needed it yesterday. We need it now. But in the meantime, as we work on that, I think that we also have to think about other strategies. I work on a palliative care outreach team whose caseload has quadrupled just over the last couple of years. We need to support and fund medical care, psychiatric mental health care, social services, and scale up harm reduction as well in the meantime. And we also have to really center and support people with lived experiences in our models of care. We will never solve or end homelessness if we do not involve the people that are being impacted. I know Torontonians care. I know Canadians care. 72% of Canadians want to bring an end urgently to homelessness. So people want compassion for their politicians. And I'm glad to see this is being talked about in this mayoral race that we're seeing right now in Toronto.
And so you clearly must be speaking to people within the, people who are looking for homes community, Dr. Tassani. What have you heard from them? What is their reaction to what the move the city made just 2 days ago?
I think I'm hearing two things. I think I'm hearing that they've heard these kinds of messages and rhetoric before, and people are frustrated with the fact that there continues to be rhetoric. This declaration of an emergency on homelessness cannot be rhetoric. It has to be step forward. It has to be action, and that's also what I'm hearing. I'm also hearing that there's hope, that there are many people out there who feel that given what has happened, the immense suffering that people who do not have homes have experienced, and the fact that the public is seeing this and wanting to support an end to homelessness, I think that people are really hopeful. And so we need to come through. We need to follow through. We need action. And so that's it. This is just the first step. Now we need the action.
Definitely looks like a step in the right direction as a first step indeed. Dr. Tassani, appreciate the time as always. Thanks for being here on Live at Noon.
Thank you very much. Have a great day.